Hello, this is Team 7. My name is Ernest.
I'm Kelsie Bryant.
Luis.
And we are going to be introducing a method to resolve the Poisson effect and CRP assays. C-reactive proteins are a pentameric protein with a coordinate structure that has 5 folded protein subunits. CRP is constructed within the liver, and it is usually presented in the serum or the blood serum of the individual. The concentrations are usually indications of sign of inflammation or infection, usually within an area or body. CRP is a useful biomarker to indicate cardiovascular diseases such as atherosclerosis, diabetes, and respiratory systems. Currently, methods to measure and detect CRP involve optical detection, nanomonitors, enzyme-linked immunosorbent assays like ELISA, immunofluorescent assays, and currently what we are working on is latex agglutination. Usually chemical involvement with the CRP is a common method used to immobilize anti-CRP antibodies in order to allow biological modification. Biosensoring of the CRP is also another method of detection, such as like the lossy mode resonance. And currently methods are either split into qualitative or quantitative measurement. Since we are working with latex agglutination, it's more of a qualitative analysis, such as finding the indication of CRP activity, and with a minor aspect of quantitative measurements such as ranges. Currently, clinical testing is done using different types of biomarkers, such as CRP, in order to give an estimate or range of the diseases. Other diseases that can be amplified are chronic obstructive pulmonary diseases, rheumatoid arthritis, atherosclerosis, can be diagnosed using CRP testing. Currently, antibiotics can also be estimated, like the quantity of or decision whether antibiotics is a decisive option for treatment using CRP, usually within a threshold of 20 to 40 milligram per liters being the optimal range for antibiotic usage. Latex agglutination assays allow for the qualitative assessment of CRP molecules within the serum. Basically, the method involves using latex molecules with anti-CRP antigens and allowing the molecules in assays to mix with the serum of the individual, and if agglutination occurs, then that is an indication of CRP within the serum. And the waiting time for assays usually range from 15 to 20 minutes. After waiting for a period of time, the qualitative assessment of CRP inside the serum would be given. Currently, the problem in latex agglutination assays is the Poisson effect, which is a natural phenomenon that allows detection, that does not allow detection, and it makes the assay to be retested and washed for multiple times. This causes more work and higher costs during CRP testing. What adds to the Poisson effect are different immunoglobulins such as M and G binding to the CRP antigen on the beads, along with C1 complementary proteins within the serum, and this blocks any access of CRP to the antigens. This leads to false negative assays. Our goal for this project is to develop a revised method of latex agglutination detection for CRP, along with improving techniques to increase the accuracy and affordability in this assessment. along with reducing any proton effects occurring within the serum to allow better accuracy to determine the range of CRP within the serum. And by using these new variable factors to assay, it could give a better determination of the proteins inside the serum. So basically, what we will be revising is by sticking with anti-CRP antigen coated beads and allowing the serum to be incubated with D3-erythritol or DDT to inactivate any immunoglobulins such as M or I, and from inhibiting any C1 complexes, C1 complex proteins to bind onto the beads. Using C1 inhibitors would also help to inhibit any C1 complex formation to attach to the beads, along with increasing the heat within the serum to, as I said, to inhibit C1 complex formation. And now, Kelsie will now be talking about how the in vitro process will work.
So our in vitro experiments will be performed outside of an organism. It'll be within a petri dish or a test tube. So our cells or tissues are going to be introduced to agarose. Agarose is a form of agar. Agar is able to closely resemble the natural environment of the cells by creating a 3D complex. It also preserves the proteins of the cells, which allows for a more natural reaction. We will also be introducing a C1 inhibitor. This will prevent the proton effect. It will also prevent binding of the secondary antibodies. Together, the agarose beads and the C1 inhibitor should be able to preserve the CRP proteins. And our method of detection would be agglutination. Now, our in vivo experiment will be performed within a living specimen. For this, we chose 10 mice, all of them being the same purebred species. We chose mice because they closely resemble human characteristics more than other animals when it comes to similar genetic, biological, and behavioral characteristics. We will have 5 of them injected with C1 inhibitor solution and 5 of them not injected. And then there will be a dose of 500 microliters every 5 minutes for 3 to 4 days. We have a plasma protease C1 inhibitor with a serpin derivative, the primary regulator of the immune complement system. We will also implement a C1 esterase inhibitor solution. This will also reduce the proton effect. This is what the dose of 500 microliters that we will be introducing to the mice 5 minutes every 3 to 4 days will be composed of. So our pH conditions in the body are typically between 7.35 and 7.45 within the blood. Now, an acidic pH is more of a native pentameric form of CRP, which converts into another pentameric that allows for attachments of other proteins. Whereas at basic pH, the CRP is present in a compact monomeric structure. This may produce a cause affinity for CRP binding to the latex complex of the agglutination, which tests at the pH lower than the 7, or opposite effects are present with basic pH. Now, the calcium ion solutions also inhibit binding functions of the CRP protein, CRP at normal blood pH. The temperature affects conditions of CRP concentrations. It's important to note that this is not by causation, however, it is a correlation. CRP levels will rise proportional to temperature increases. So when an individual experiences a fever, their CRP proteins will also be higher. Whereas osmolarity is also considered a correlation, not a causation. And the osmolarity increments at the intravascular level are associated with increments of CRP concentrations. The CRP and blood osmolarity increments are caused by inflammation process. And then Luis will further discuss the agents of interference.
Thank you, Kelsie. Well, regarding agents of interference, it has been already discussed in this article that several researchers support the correlation between CRP production and diet, indicating that diets heavy in cholesterol and sugar are directly proportional to the CRP levels, and that healthier diets based on unsaturated fats, such as seafood and vegetables, are inversely proportional to CRP production. Smoking is a factor that is directly proportional to a boost in the levels of CRP. Smoking is well documented to be linked to an exacerbation in the atherosclerosis process, which is an inflammation of the arteries. Studies have demonstrated that CRP levels can be effectively estimated using the cigarette pack per year formula. Also, that the effect of smoking lasts for many years after the subject has quit. High levels of CRP have been found in individuals even after 10 years of stopping smoking. Contrary to smoking, alcohol consumption has been found to indicate a decrease in CRP levels, and this may be explained since alcohol is involved in several anti-inflammatory mechanisms. Another aspect that affects CRP levels is the body mass index. Elevated CRP concentration has been found in obese individuals. An explanation for this may be the release of IL-6 from adipose tissue. IL-6 is an interleukin that stimulates the CRP production in the liver by activation of the Janus kinase. Also, studies of a group of 30 male marathon runners indicate that CRP levels rise from a pre-race concentration of 1.1 milligrams per liter to a post-race concentration of 4 grams per liter. And this may indicate that excessive exercise may cause an increase in CRP levels. And it was shown to be even more aggravated 24 hours after the race. Then, the limitations of our testing are cost, which causes a huge limiting factor into the manufacturing and administration of the test. The affinity to bind to the receptors is limited by the system, since it has a crucial part to allow detection of CRP molecules binding assuring to the receptors. Biological events reduce the amount of CRP molecules. For instance, increase of a degrading enzymes prevent the C1 complex from forming. Sensitivity of our results. Determining the sources of uncertainty from the output of the design. Probability detection of actual positives in order to avoid false negatives. High sensitivity with low specificity is an indication of high uncertainty. Thank you. And now Guillermo will talk to you about the specificity and linearity of our results.
Thank you, Luis. So, in relation to the specificity and linearity of the results, the specificity of the system will be determined in the same way that the sensitivity. So, it allows us to assure that the real negatives are identified, which are the amount of non-CRP molecules attached to the better receptors. The linearity of the system is measured based on the relationship that the inhibition of non-CRP molecules has with the number of CRP bindings with the receptors of the beds. So, in relation to the method of analysis, multiple samples testing with a nonlinear approach were run, taking note for unpredicted intermolecular interactions. Variance of the attendant CRP in each assay allowed to measure the uncertainty of the binding of immunoglobulins. At least 100 assays on multiple blood types is conducted. Results are plotted in a scatter plot for a visual sensitivity and nonlinear regression. In relation to accuracy is going to be measured using a cumulative estimate of proper CRP receptor binding. Biological protein marker binds on the CRP receptors on the bed using individual amino acids targeted directly for CRP binding. Uncertainty results are reduced using optical methods, and specifically, these tags are applied using fluorescent organic dyes. However, this is limited by temporal resolution. The accuracy of the receptors have to molecular disperse in the plasma. The solution is determined by measuring the binding affinity of the receptor to CRP. In relation to the overall cost per sample, companies such as Cortez Diagnostic and Fisher Scientific sell CRP agglutination tests. These tests are typically covered by the insurance of the provider and are done with regular blood work. the overall cost of range, it would be around $50 to $75 per qualitative test, and companies sell kits ranging at different units. Usually, a unit sample has a cost of average of $1.18. Cost as a huge limiting factor into the manufacturing and administration of the test. In relation to the portability and detection time, tests are bottled and administered to the patient in a simple way. In general, it is stored in the hospital or sent via mail to external laboratory. Detection time is relatively small, since it takes about 2 minutes for CRP molecules to be detected. In relation to the future advantage, although the detection time is relatively small, further advantage can be implemented to reduce even more the time interval. The reduction of the detection time will accelerate the availability of critical tests, so that we help expedite the diagnostic and disposition of the patient. Improvement of accuracy of the result can also be achieved by implementing methods that will reduce the systematic error. Accuracy is measured by comparing measurement to value expected from the theory. Lastly, the cost can be reduced to make these tests even more accessible to people. So this can be achieved by employing cost-effective molecules with similar structure and function, implementing also low-cost material without losing the quality of the results. If these advantages are implemented in the CRP test, it will become more accessible and medically desirable, impacting in life of people worldwide. Thank you so much, and have a great day.